Hi, I'm Carolina Boyd, Communications Associate at Legacy Community Health. The CDC recently urged all pregnant people to get vaccinated for COVID-19. Now, this comes at a time where hospitals across the nation are seeing a spike in the number of pregnant patients being treated for COVID. Today, I'm talking to Dr. Rachel Robinson, Medical Director of OB-GYN at Legacy Community Health, about the COVID vaccine, pregnancy, breastfeeding, and fertility. Thank you so much for joining us today, Dr. Robinson.
Thanks, Carolina, and thanks for having me to discuss this very important topic, especially since we know that the Delta variant is rapidly spreading across the country and vaccine rates in pregnant patients remain low.
So let's start off with this question. Is it safe to get the COVID-19 vaccine if you are pregnant?
Absolutely. COVID-19 vaccination is recommended for all people 12 years and older, including people who are pregnant, breastfeeding, trying to get pregnant now, or might become pregnant in the future. Evidence about the safety and effectiveness of COVID-19 vaccination during pregnancy has been growing. Data suggests that the benefits of receiving a COVID-19 vaccine outweigh any known or potential risk associated with contracting the virus itself during pregnancy.
So what are the dangers if you do end up contracting COVID-19 during pregnancy?
While the overall risk is considered low, pregnancy is associated with increased risk of severe maternal illness, ICU admission, mechanical ventilation, and even death. There's an increased risk of complications from COVID-19 in pregnant patients with underlying health conditions like diabetes, obesity, and cardiovascular disease. Pregnant women who are Black or Latinx appear to be disproportionately affected by infection with the COVID-19 virus. And pregnant women with COVID-19 are also more likely to deliver a baby before the 37th week of pregnancy and might be at increased risk for complications.
So are there any risks associated with getting the COVID-19 vaccine while breastfeeding?
COVID-19 vaccines are currently available to all breastfeeding individuals. The vaccines are not believed to be a risk for breastfed infants of mothers who were vaccinated. Any vaccine components that make it into the breast milk are likely to be quickly inactivated when the milk is digested. In addition, recent studies demonstrate that your COVID-19 immunity can pass to the baby through the breast milk after you receive the vaccine.
How does the COVID-19 vaccine affect fertility?
There is no indication that any vaccines, including the COVID-19 vaccine, cause either current or future fertility issues in either women or men. Getting vaccinated before you get pregnant may actually prevent you from developing COVID-19 during pregnancy.
Can the COVID-19 vaccine actually give you COVID?
The COVID vaccine cannot give you COVID. It is not a live virus vaccine, and there are no ingredients in the vaccine known to be harmful to pregnancy or to babies. There are some expected side effects with taking the vaccine, as with any vaccine, the most common being soreness at the injection site. If you experience fever, we recommend taking Tylenol or acetaminophen, which is safe in pregnancy.
So where can pregnant patients go to get a COVID-19 vaccination?
Well, Carolina, I am glad you asked because I'm happy to report that Legacy Community Health offers vaccination at our clinics for everyone ages 12 and up, including pregnant patients. Vaccines are being provided at no cost to the individual. While some locations have walk-in vaccinations, we encourage you to make an appointment. To learn more, visit our website or call 832-548-5000.
Well, Dr. Robinson, you have shared a lot of important information with us today. Thank you so much for joining us.
And again, thank you for having me, Carolina. And I just want to say, whether or not a pregnant patient decides to receive the COVID-19 vaccine, they will be fully supported in their decision. There are ways to limit exposure to the virus, and the best prevention methods include social distancing, wearing masks in public places, washing your hands, and avoiding unnecessary activities.
Great information. And thank you to everyone who's watching today, and make sure you keep checking back for more videos with our Legacy Community Health providers. Goodbye.
Bye.